Thank you for joining us for this special report on COVID-19. In this episode, Dr. Lewis provides clarity on what nutritional supplements may provide a boost to your immune system. Also, Dr. Lewis provides recommendations on where to source these supplements and recommended daily dosages. Dr. Gary Lewis is a medical officer for the North Shore Health Department, a family practice physician, co-owner of the Thiensville Health Alliance, and member of the Thiensville-Mequon Chamber of Commerce and Business Association.
Good afternoon, ladies and gentlemen. We're here today live to talk about supplements. Supplements are a very confusing subject because, you walk into a pharmacy and there's a lot of guesswork about which ones to buy and which ones work and if they work. So let's take a look today and try and take some of that guesswork out of choosing a supplement and see if we can put together some valid reasons why they are beneficial, in the hope that we will try and protect and prevent this viral infection from spreading and from contracting this disease. So that being said, what supplements, if any, should I be taking during this viral outbreak? Let's take a look at our immune systems and immunity. The bad news first, or the reality, is that the coronavirus has many mechanisms for evading our natural immune systems. That's very clever. Therefore, it isn't clear if stimulating the immune systems will offer much protection. However, if we have weakened immunity or immune systems, this increases our chances of contracting the disease. So it does really make sense to strengthen and optimize our innate immune systems. So, once we contract the disease, the role of the immune system, in fact, becomes overactive, and this contributes to damage done by the virus, especially in the lungs. So care must be taken with our immune boosters in these cases. Let's take a look, that being said, at what substances are really helpful for us. And in order to answer that question, we need to look at what research has shown about the biochemistry behind the mechanisms of damage from this coronavirus infection. There's two things here that are really important. Firstly, ACE2 enzymes are produced by various organs in our bodies, particularly the lungs, for health and vitality. Now, this coronavirus attaches to these ACE2, what we call enzyme proteins, and causes it to lose its enzyme activity and eventually causes ACL2 exhaustion. Once the virus enters the cells, secondly, it also produces an enzyme called 3CL protease, which allows it to spread from cell to cell and to adjacent cells. So what supplements cause ACL2 enhancement or improved function inside our bodies? And that's the cause, that's the reason we take them. Plant-based whole foods. Curcumin is a spice found in turmeric. Resveratrol, which is found in red grapes and other foods, decreases inflammation as well. Rosmarinic acid, it's a tongue twister, found in spices like rosemary and oregano, and it also works as well with resveratrol. Panax noto ginseng, an Asian herb in Chinese medicines. One I particularly like is alpha-lipoic acid, which is an antioxidant. It's one of the strongest substances in our bodies. It's a natural fatty acid. It strengthens ACL2 activity, and it inhibits 3CL protease from the virus. Elderberry, which basically does both those functions as well. This compound should be stopped, however, in more advanced infections due to its immune boosting effects. There's another one called herbacetin, found not in the flaxseed oil but in the husk, and that's about the main ones. Adequate protein supports immunity. Exercise helps with stimulation of ACL activity. Vitamin D and zinc are very important. Quercetin and zinc work together and taken early in the course of infection. Certain mushrooms are very immune stimulating, like maitake, shiitake, and turkey tail. They stimulate antiviral activity. Probiotics and prebiotics are very good, especially lactobacillus containing compounds. These are things found in sauerkraut and other fermented plant foods. So there's a disclaimer here, and that basically there aren't any guarantees about contracting the disease. But the guidelines put out by the CDC and the WHO are our baseline, which is quarantine, isolation, hand washing, etc. for spread of the infections. Supplements are helpful, and hopefully I'll put a little nutshell of a supplement package out here, which I think are beneficial, has good research, and let's take a look at what this consists of. Firstly, the first supplement that I recommend in a nutshell is curcumin, which is found in Turiva, and the dosage of this is 1 to 2 caps a day. Resveratrol, which is found in Resveratrol Supreme, 1 capsule daily. Alpha-lipoic acid, very easily found. Elderberry or elderberry syrup, 1 tablespoon every other day. Herbacetin. Then zinc or zinc supreme, taken 30 milligrams daily. Be careful not to overdose on the zinc. A probiotic, such as orthobiotic, 1 capsule daily. And lastly, vitamin C, or sufficient C, I like, which is 1,000 milligrams a day. You can even take it twice a day. In addition, plant-based foods, adequate exercise, and dietary protein. So I hope that this is helpful for you and takes some of the confusion about what's the value of supplements. And thank you very much for taking the time to view this video and giving this your consideration. And mostly, be well. Please call our office for further and more specific questions about the disease, and also information about treatment and therapies for improvement of your immune systems. The number to reach would be 262-242-3369, and also look out for us on Facebook as well. Thank you.